The latest BSGA study paints a concerning picture. Sexually transmitted infections, STIs, remain dangerously underestimated in Germany. Despite decades of awareness campaigns, many people continue to downplay their personal risk, making preventable infections more prevalent than they should be. The findings highlight a troubling gap between knowledge and action, as well as the persistent stigma surrounding sexual health. While a significant percentage of sexually active individuals have used condoms at some point, their consistent use remains alarmingly low, especially among those who are not in committed relationships. Half of these individuals report that they do not always or even frequently use condoms, and the most common justification is the assumption that both partners are healthy. This false sense of security is a major factor driving the continued spread of STIs, as many infections, such as chlamydia, can remain asymptomatic for long periods, making them easy to overlook and unknowingly transmit to others. The study further reveals that discussions about STIs are still largely avoided. An overwhelming 73% of people in committed relationships admit that they never spoke about STIs with their partner before having sex. This silence, rooted in discomfort and stigma, significantly increases the likelihood of unprotected encounters and unchecked infections. The reluctance to openly discuss sexual health not only affects individual well-being, but also contributes to the broader public health challenge of containing STI transmission. It is clear that education alone is not enough. Deep-seated attitudes towards sexual health must change. If awareness campaigns fail to address this social taboo, STI rates will remain high, and more people will unknowingly suffer from long-term health consequences. One of the most alarming insights from the study is the widespread lack of awareness about chlamydia, one of the most common STIs. Despite being highly treatable when detected early, chlamydia often goes unnoticed due to its mild or absent symptoms. If left untreated, it can cause severe complications, including infertility in both men and women. The study found that only 60% of respondents had ever heard of chlamydia, and knowledge about existing screening programs is shockingly low. Among the general population, only 16% are aware that free chlamydia screenings are available for sexually active women under 25. Even within the target demographic, awareness remains inadequate. Less than half of women aged 16 to 25 know about this crucial health service. These numbers indicate a failure in public health communication, as essential preventive measures are not reaching those who need them most. The BSGA has launched the #WissenWasRumget campaign to combat this lack of awareness, using influencers to spread information about chlamydia and sexual health. While this initiative has the potential to reach younger audiences, the question remains whether social media efforts alone can change entrenched behaviors. Without structural improvements in sexual health education and increased accessibility to STI testing, superficial online campaigns may not be enough to drive real behavioral change. The reliance on influencers, while effective in some cases, also runs the risk of trivializing the serious consequences of STIs by reducing them to catchy hashtags and fleeting trends. The study's findings should serve as a wake-up call. The continued prevalence of STIs, combined with the widespread lack of awareness and precautionary measures, suggests that Germany is failing to adequately address sexual health. While initiatives like Liebesleben provide valuable educational resources, they're not translating into sufficient preventive action. People continue to engage in risky sexual behaviors, underestimate their vulnerability, and avoid discussions that could protect them and their partners. The misconception that STIs only affect certain groups, such as those with multiple partners or those engaging in sex work, creates a dangerous blind spot that leaves many people unprepared and unprotected. If these trends persist, the consequences will be severe. More individuals will suffer from preventable infections, leading to complications such as infertility, chronic pain, and increased susceptibility to other diseases. The healthcare system will bear the burden of treating conditions that could have been easily avoided with better prevention strategies. Beyond the medical implications, the continued stigma around STIs will prevent people from seeking help, further fueling transmission rates. The evidence is clear. Germany needs a more aggressive and comprehensive approach to sexual health education and prevention. This includes mandatory discussions about STIs in schools, normalized routine screenings, and stronger public messaging that challenges misconceptions rather than merely providing information. Without decisive action, the problem will only worsen, putting countless people at unnecessary risk.